Okay, so guys, this question is basically about the contraindication for thrombolysis, right? Now, when you look at the options, presentation within 3 hours of the onset of symptoms gives the best result for thrombolysis. So certainly that's not a contraindication. It is an indication. Okay. Now, if the patient has past medical history of myocardial infarction 2 years back, it is not a contraindication. Remember, recent myocardial infarction, recent MI is a contraindication because that infarcted area in the heart can develop a hemorrhagic transformation. That is a concern. That is why it is a contraindication. But if there is a remote MI or a simultaneous MI, there is no contraindication for thrombolysis. Like a patient who presented with an ischemic stroke and also has an MI ongoing, both can be benefited with thrombolysis. You can definitely go ahead and do it. Any patient with a background history like months back, years back had a MI, no contraindication. But a recent MI is a contraindication. Okay. So certainly this is not a contraindication. Now, option C, BP more than 200 by 100. This is a contraindication. Not an absolute contraindication. Remember this point. Because when you look at the contraindication statement, it says BP more than or equal to 185 by 110 millimeters of mercury despite treatment. Despite treatment. That is a statement. Like in this case, if you are not able to bring down the BP to less than 185 by 110 millimeters of mercury with the treatment, then it becomes a contraindication. Here, patient has presented around 3 hours after the onset of symptoms. We have 1.5 hours of window period to lower the BP. If you can lower it to less than 185 by 110, you can go ahead and do the thrombolysis. That is a relative contraindication, but certainly a contraindication. And they're asking which of the following is a contraindication. So I hope we found our answer here. Option C would be the answer. Family history of diabetes, obviously not a contraindication. So I will stick to option C as the answer. Remember that. Okay. Thank you.